Hello and welcome to the Canine Rehab Movement Podcast, where we discuss all things canine rehab, fitness, and sports medicine for our four-legged companions. We cover a variety of topics with amazing guests in an educational and entertaining format. Some would even call it edutainment. Now, we are all about canine rehab and fitness training, or craft. So join us and hone your craft with the Canine Rehab Movement Podcast. Now, today's episode is brought to you by Pawsitive, your trusted destination for leading preventative, supportive, and rehabilitative pet products. Make your practice more efficient with top brands all in one place. Whether you need help-em-up harnesses, Fit Paws exercise equipment, Muffins Halo for blind dogs, Response Systems laser and PEMF therapy devices, or canine carts for mobility support. Discover how easy it is to find the best products to keep your patients healthy, aid in their recovery, and help them age gracefully. So visit pawprosper.com today. Now today we have a guest who is a CSCC, CCFT, KPA, CTP, and that is Bobbie Lyons. She is an expert in canine fitness and a professional dog trainer. She has been working in both fields for over 20 years and has trained with some of the most highly respected veterinarians, rehabilitation specialists, and dog trainers. Bobbie specializes in designing exercises that support the daily activities and movements required by a dog's life, sport, or recreation. Additionally, Bobbie specializes in teaching fine motor skills, targeting, trick training, obedience skills, manners, puppy skills, and surface training. Bobbie, thanks so much for joining us today. It's a really good topic. I really have gotten into canine fitness in the last couple of years and would really like to get into it today with you, as well as the CSCC course. So if you could, take it away.
I think one of the big points about canine fitness that kind of puts everything together is the difference between prehab and rehab. Like prehab is going to be trying to prevent injury, trying to get the dog to use their body better. So maybe if they do get injured, the severity of injury is less. And then your rehab is after injury, after things go super wrong. I also find that canine fitness will help if the dog does get injured, then they know the exercises that the rehab person is going to do. I hear that a lot from my clients, that if they have any kind of minor injury, that the dog recovers really fast because they don't have to teach the exercises, especially to a dog that has not ever done them before.
Yeah, no, and it's really cool. And I do love the points that you brought up, prehab and rehab. Unfortunately, I think rehab is still lacking the awareness. Rehab is lacking that much more.
Yeah.
And coming from the human PT world, I'm all about the prehab, right? I'm all about injury prevention and things like that. So I love that. And especially, I don't think there's enough awareness about prehab before surgery, right? Like that prehab is so important for the muscle memory of the post-op recovery care, right? It can help to just recover that much sooner. It's been shown to be that effective, at least in the human world. I don't know how much research is out there yet for the canine world, but
there's not a lot of money for research in the canine world, unfortunately.
Yeah, I know it irks me a lot, but I do think we should still be taking the insights from the human world for sure. But yeah, I love the prehab rehab bit of it all. And I do think, especially a lot of our rehabbers out there, me especially, I love therapeutic exercise. Therapeutic exercise is that tool that really gets your patient through PT, out of PT, and making sure they don't have to come back to PT. for the same reason anyway.
Well, and I think another thing, and not to generalize too much, but with fitness, we're always, I'm hoping that everybody is always working the whole body and not just one part. And I do
Yeah.
find sometimes rehab that they're so focused on the injured leg that they forget about
Yeah.
the rest of the body sometimes.
Yeah.
And I'm always looking at, from day one, I'm looking at how is the dog standing. For instance, I see a lot of injured dogs with TPLO surgery or things like that. And they're just looking for flexion of the leg to keep that range of motion going.
Of course.
Looking at how are they flexing the leg? Is it in
Right.
the body? Is it in line with the hip? And no, it's not going to be at first, but we're always striving for that. And so I do find that dogs that know that good, so sit position, say prior to surgery, and if they get into surgery quickly versus, we'll say 6 months after they got injured,
Yeah.
then I have a better chance of getting that dog back to its normal activity after rehab and using that leg. But if it goes on, it's really hard to get them to use a leg after they've decided that they don't need it anymore.
Oh yeah.
They're just like,
I
it's
know it.
not just hanging there, it's fine.
Yeah. Certain breeds over others, especially. Yeah.
Malinois will run until its legs fell off. Yeah. And there's always things too. I work with law enforcement and IGPs or like protection sports and things like that. And not everybody has the skills to train, to get the dog to do the things that I normally do, we'll say. And so one of the things is just like really trying to work with the handler on how to get those exercises done. And I find in rehab, a lot of times they don't have time to train the handler to get the exercises done. So one of the things that really helped me in the very beginning of canine fitness, and I've been doing this for 18 years, is I had a rehab professional who just handed her rehab plan to the owner and said, go talk to Bobbie.
Okay.
Because go find out how to do the exercises. So basically, I spent a lot of
time for you.
Yeah. I spent a lot of time working with her and also just learning the exercises that are normally done in rehab, how I like to change them in fitness, because from a fitness perspective, I'm always looking at posture. And that's not, I wouldn't say that rehab doesn't look at it. They just don't look at it with the same eye a lot of times.
Yeah, a lot of good talking points there. And I would say for sure, there's definitely a demographic in the rehab, probably the newer kind of therapists out there that, and I can even speak for myself when I was a newer therapist too, where we wanted to make sure we got everything in that rehab session. And when it came down to it, especially the home exercise programs, we did try to, at least me, I tried to give them that knowledge, but it definitely was quick. And I did piggyback a little bit off of the videos and the description that came with the HEP, and then would do a follow-up on the second session and everything. But yeah, I definitely think, especially in the beginning, there wasn't a lot of time for those pet parents. And
really, you'd have somebody else in the office that could take that client and so we'll see somebody else, but that's not always realistic.
But I was just going to say that's not always the case. Not everybody has the luxury of that. But I do agree too that posture is huge, and especially coming from the PT world, we've always, or at least my mindset always was, working from the core out. So it doesn't matter if it's a TPLO, right? Now the hips are thrown off. Now the low back's thrown off. Now the core muscles are thrown off, right? Everything's thrown off, right? So you do have to focus way more than just the diagnosis that's given to you. And I think that's what I love so much about your course is that no matter if it's a seasoned therapist or a brand new therapist, I think it's super important to attend your course and really get a refresher or an enlightenment or just a kind of revamp where they're like, you know what? This is important because this is what's going to keep my patients from coming back to me. And that's usually the goal for PT. So usually.
That's what the side, maybe not, but But and I think like in veterinary medicine in general, what I find is that there's just not a lot of training for dog training. How do you get the dog to do it? Not just like how do you get the owner to do it? How do you get if you don't know how to get the dog to do it, then how do you train the owner to do the exercises at home? And I think that's also where we'll say gray area comes in because I think there's a lot of, oh, that's good enough. Great job. You did a great job.
We'll work on it next time.
Yeah. Where I'm like, no, we have to back up because now I have 3 weeks of you doing it
wrong. Yeah.
And not that nothing is ever perfect, but we're always striving for what should look perfect. Sometimes with TPLO, they don't ever look perfect again.
Yeah.
Sometimes they do. It really across the board depends on so many things.
Totally. And I agree with what you were saying before. When a dog tears its CCL and goes into surgery 2 weeks later, has a better chance of recovery than the dog that's 6 months later. Its body's all distorted and torn up now because they've already reprogrammed themselves to compensate on the other 3 legs. So then now when it comes out of surgery, it's already used to not using that 4th limb and it still hurts. I don't want to use it. Leave me alone.
It hurt last time I used it like 6 months ago.
Yeah. My mind is up. I'm done with this.
I always ask, what were your dog's previous injuries? And I got to say, now I will literally be like, they'll say, no, I've never been injured. I'll be like, not even a toe. I go right for the toes. I'm like, how about a nail?
Yeah.
Because once a dog has injured a toe or a nail, they can actually decide not to use that leg.
Totally.
For that reason.
Totally. And even if they look like they're using that leg, they're not using it at the percentage they used to use it at. And now their whole body is starting to get displaced. And that was a huge thing in the human world too. You stub your toe, you twist your ankle. Now you're actually, yes, you're putting your foot down, but you're not using it like you used to. And now you're retraining your body to not use it like you used to. And then all of a sudden their low back hurts, their hips are off, and it's all because of something that happened, like at the paw or at the foot. Yeah.
Yep. And I always tell people, people are always like, oh, it's just a toe, especially my agility people. It's just a toe. And I'm like, no, it is the first contact to the ground, right? So if your dog jumping is driving over a dog walk or even through a tunnel, because there's the little ridges.
Oh, yeah.
And the tunnels are like, honestly, one of the biggest culprits for injuring toes.
Oh.
But they just think, oh, it's just a toe. And I'm like, I have agility people who have never gone back to agility after a toe injury because the dog keeps getting lame over and over again. I have a search and rescue dog that had to have, I actually was born with one toe dramatically shorter than the other toes. And he had a shoulder injury and they went through rehab. They were finally sent to me. They're like, I don't know why he keeps injuring it. And I'm like, so anybody thought about his toe? Like he's just not using his leg as well as he could because that toe, he's a search and rescue dog. He's doing urban search and rescue. He's like climbing on stuff, but he's just not using that leg because of the toe. So what we found is his new normal, we'll say, or is probably always normal.
Normal, yeah.
If he works out really hard, if they do a long search, he will be a little lame afterwards for a few days.
It totally makes sense. And it's so funny when I was seeing human patients as well, that they never really thought or knew of how important the pinky toe was. It's just this little digit. Like, what happens if it's never there? But you can totally lose your balance, totally become all out of whack throughout your body. So as small and insignificant as you might think it is, it does play a huge role. So yeah, when there's toes on a canine that are shorter than they should be, and now you've just made that dog work, it's been unbalanced the whole time. And that shoulder's just taking it and poor pup.
Yeah. And he did search and rescue for a really long time. I think he's just now getting retired. But and she was a person that also does like 10, 12-mile hikes and, and her dog has been acclimated to all of that. I think they now do 6 or 7 miles a day, but she's had to adjust things just because she didn't want him to be too sore to search.
Yeah.
So
that's what you got to do, though. That's what you got to do. But let's piggyback off of that. Let's discuss like various fitness exercises and their possible objectives for different conditions and breeds, even occupations, I guess you can say.
Yeah,
right?
I work with all of the occupations, everywhere from a pet dog to law enforcement, agility, flyball, dock diving,
Yeah.
all of the performance sports. I think one of the big misconceptions, and I don't want to get out in the weeds too much because this is my hot topic, is the
I like
idea
hot topics. Yeah.
the idea of rear end awareness and the exercises that came of that concept of let's teach the dog where their rear end is. And what I have found is that just backing your dog up until they hit something and pick up their feet is really teaching them to bear more weight forward. It's not teaching them anything about their rear end. And so what I like to do is train that rear end awareness as a forward motion to a mat where they can actually learn to use their whole body to collect and stop and
Okay.
nail the landing by
Yeah.
their feet on the mat. For me, that trained the whole body to break versus the shoulders.
Yeah.
And what I find is if I ask anybody, what's a rear end exercise or rear end awareness exercise that you do for your dog? And they're like, we back up to this and we back up to that and we back up.
Go-to. It is.
It's 100% the go-to. And
Yeah.
it really is it's a front limb driven exercise.
Mhm.
That's what it is. And I have people, they'll do the spider up the wall exercise where they back their dog up the wall. And I have a client that has a border collie that when I first met her, if her dog got near anything with its rear feet, it was doing a handstand because she had taught the handstand.
Mhm.
And it was obviously really reinforcing to that particular dog, and the dog had the strength to do it. But in
Mhm.
general, I don't recommend handstand for dogs because it's really hard on the shoulders. But I think that changing that mindset for across the board, all sports, all people that I work with, is if we can get the dog to use more muscles in their movement and in their stopping motion, then we're ahead of the game. I teach rear foot targeting as a forward motion to my pet clients, to everybody, because that's one of those foundation behaviors that really teaches them how to use their body. Because once you add speed to that, they have to use their whole body to break, to anchor those back feet.
Yeah.
They have to shift their weight back. And not that I don't pair that with lots of other things like other exercises to strengthen those same muscles, but people also underutilize things like I never train a dog to sit and then down until they literally know a folding down, a tuck sit, a rock back, the different sits. And that's actually something that always came up with rehab plans is they would just be like, I want the dog to sit 10 times. And for a long time, I would go back and be like, do you want a tuck sit or a rock back sit? This is what I would get. Huh? And really it's because
I don't think you might get that out there in the rehab world.
I still get the people that don't know the difference, and that's okay. But I just, they're looking at flexion of the joints, right?
Mhm.
I'm looking at what are we trying to strengthen? Because a tuck sit really strengthens the core and the abdominal muscles, the spinal muscles, and the shoulders. And a rock back sit really strengthens the rear limbs.
Yeah, no, that's super important too. And I know there's certain goals in rehab and everything like that. But
I'm not
the
trying to pick on
overall,
rehab. It's just that's the
for
difference
sure.
in the way we
And
look at things. Mhm.
absolutely. And I think it's important what you said there that the rehab practitioner shouldn't just look for that flexion, that range of motion, but also that strength. And we should be approaching it as a total functional goal, right? Not just can we hit that range of motion? Can we make that hip flex? Can we make that stifle flex? What about that? I think sometimes specialists can just get too laser focused, right? Like we really need to hit that flexion. We really need to hit that flexion, but then you're forgetting about the other fundamentals of what you need to be doing with the patient as well. So I think it's a great point, and hopefully it just reignites that thought process for the listeners.
I would really love it if, and it all comes down to dollars and cents, but I would really love it if some rehab professionals started hiring some CSCCs to come in and train the exercises and help with the variety of exercises. Because the other thing that I think is that, like, people always ask me, Bobbie, do you have a library of exercises? No, I don't have a library of exercises. Like I take the dog, I look at what they need, and I start changing things out until I can get the movement I'm looking for. And I actually just had a client yesterday. She's like, I just love how you just adjust things so fast. And I'm like, my goal is to get the dog to do it the way I want to do it here, and then talk to you about what you have at home that can help us do that. So is it a narrow platform? Is it 2x4s? Is it whatever it is? It's just really talking them through, this is what you're looking for. And I get lots of clients that will come back and say, it's not perfect. And I'm like, it's okay. Nothing is perfect. We're always striving for perfect, but we may or may not get there depending on the dog.
Yeah. Yeah. And to piggyback on the hiring of the CSCCs, I will bounce that back to you and say, we need more population of them, because I would gladly hire one. There's not one in my area though, but I would gladly hire one, because I do think you guys are important. And I do think collaborating with that specialty would be huge for the optimal outcome of the patient in front of us. So yes, 100%. My bounce back to you is create more.
I'm trying. We've had 400 people go through the course, but they're scattered everywhere.
That's amazing numbers.
Right? Yeah. And so we just need to keep trucking along.
That's it.
But yeah, tap for the CCFT program for years and years. And not that I want to advertise for their program as well, but they would also be a good option for rehab.
Yeah. I mean, as any program you go out into, as long as you're meeting the goal that you want, and also, creating that abundance, like I said, for the canine health field right now, because it's in such a need. So yeah, please, anybody, get certified. You have a job with me anyway.
Like I said, since we put this program together, I've been really happy with how many people have signed up. I have a lot of people who are looking now for more of the business side of things. So they're, starting to decide how they're going to add fitness to their business, or how they're going to create their business. I have a lot of people that, one of the questions that they ask me a lot is, how do you communicate with veterinarians and rehab staff? And how do you create that relationship? And it's tricky, because I do tell them that they can offer to do like a lunch and learn kind of thing. But really, for me, it comes down to clients. Like, I have clients go to their veterinary office, and during their yearly exam, the veterinarian is, wow, your dog's in really good shape. And they're like, well, I'll work with Bobbie Lyons. And that's how they learn my name. And then I will get referrals from them, not even knowing who they are.
Yeah. No, that's great. That speaks volumes on you. And that's what every fitness trainer, practitioner should always be thinking of. The work in front of you should speak for itself. But yeah, definitely advertise, definitely do your lunch and learn, be confident in the work in front of you, get it done, and it will be seen and it will be talked about. Yeah. No, it's good advice.
It's like that build it and they will come concept.
I love it.
It's a big question that comes up in the fitness world, is how do we collaborate with veterinarians? And I think when I started 18 years ago, veterinarians thought I was nuts, because I was definitely one of the first dog trainers to do fitness outside of the rehab world. I was one of FitPaws's very first clients for canine fitness. So I've had a long relationship with them, and I prefer their equipment because equipment works differently, very differently. And so oftentimes when there's like some random piece of equipment that's on the market, I'll go buy it, so that if I have a client that has one, then I know how it functions.
That's pretty awesome on your part. I would say not everybody does that, but it's a very good skill set. And I think it's a very good mindset as well, because you want to know what your patient's using. You want to know what your client's using, because you might see this wobble board that they bought and you have no idea the actual intensity of the imbalance or the instability it creates. And the only way you're going to know is A, you can have them bring it in, which is very helpful too.
Yep.
Or B, test it out yourself.
Yep.
So you
know how to
video.
Yep. And send me a video as well. Because there's obviously, I'm not going to go buy a whole line of products that, that I don't use every day. But but I do find that for me, The FitPause equipment has worked very well for all of the exercises that I do. And I design the exercises very specific to those pieces of equipment. So I do really advocate for that. Different size peanuts, length and height and all of that stuff plays a huge part. The instability of the bone versus the duo disc, for instance, it's just a matter of having a lot of dogs on the equipment. I know exactly how that stuff is going to respond to every exercise that I'm doing. Or I can anticipate how the dog is going to respond in certain situations. And sometimes I have people standing on equipment and the only thing that they're doing is standing on the contralateral side of the dog so that they shift weight to the leg that they're not using. Like that's the exercise. Just stand there and put weight on that leg. The equipment allows the handler to see whether that dog is shifting weight to that leg or not. Because just like you said, going back, because it might look like they are, they're not really putting any weight on it. It can really make a big difference in what the handler is able to see. And obviously you have to work within the dog's abilities and all of that stuff. But sometimes equipment is really just used for elevation, and it might be used to get the owner to be able to observe something more without throwing the dog obviously too far under the bus where it's too hard to have like front feet on something stable and rear feet on something that is squishy, so that they can see whether the dog is shifting or not.
Yeah. And I think it's great, that point that you brought up, like that feedback is necessary for that client, that handler, that pet parent, because again, it's not only just showing the deficits of the animal, it's also showing kind of what, right? Every time they're coming in, you still have to show the value of what you're doing. And those things, that kind of feedback is just a reinforcement all around, and it's huge.
And it's funny because I'll say, I don't know, a few years ago, I don't know when, I was teaching somewhere and I had somebody that was, I always allow the host to sit in on private lessons when I teach a workshop and then do private lessons. And about halfway through the day, she says, "I have you figured out." And I said, "What do you mean?" And she says, "You start at the exercise that you want to do. And then when the dog can't do it, you just pare it down. You just keep going down until you find that place and then work your way back up." And it wasn't ever something I did intentionally or thoughtfully. It was just, this is where I want to go. But what I found out is that it really shows the owner, hey, they can't do it. So now, and they watch me change it and then be like, okay, this is what we're looking for. And they get to see that whole process so that they can see, where the dog was compensating, which is often signs of fatigue. So it just shows the owner so much about that one exercise just during the process of going from here to where the dog can do it.
No, I think that's great, because I'm sure the owner thought so highly of the capability of that actual animal. And then they get a little humble pie, right? Okay. Maybe we need to start down here. Let's not start up there. And like I said, it really does all come back to that feedback, that reinforcement of, okay, she knows what she's doing and this is what's going to be best for my animal. So no, that's awesome. But to kind of segue from that, I'd love for you to share a little bit of your case studies, some memorable cases anyway, and the possible challenging ones too.
I have a challenging one right now, but I'm not far into it enough to know where it's going to go. I have a dog right now that I'm working with that is a referral from rehab. We're working together. The dog is getting prosthesis for a front limb. And she was born with a humerus, not an elbow, but a toe. Like when I say almost a stop pad.
Yeah. So no forearm, basically, no
forearm, no paw, no nothing. And she can move it. And we're actually working on being able to, building strength for these motions right now. But she's very low on her good limb. And I've been tasked with getting her to stand up.
Interesting. So are you working you're working on like the shoulder flexion, extension, abduction,
Hmm.
adduction kind of
Yep.
motions.
Which
Very
is
cool.
tricky
Yeah. Oh
because
yeah.
it's really tricky because there's not a lot of resistance I can put on it, if that makes sense, because I'm just right now working with just her ability to do it. And
Okay.
then
Yeah.
also some stretching as well.
Okay. Yeah.
But
Very cool.
she has really good flexion in the shoulder, but not a lot of extension.
Extension. Yeah.
So the rehab person and I are working together. And then she basically was like, we got to train her to use this leg once she gets it. And she said, I'm not a dog trainer. So here you go. Good luck. So
Okay.
we will bounce things back and forth
Yeah.
a lot during that process, because my biggest concern is that she's not going to have the strength to swing it because
Yeah.
I know that they're light, but it's going to be heavy for her.
Yeah.
And she's
I mean,
a
it
little,
starts off light, but it will eventually get
yeah,
heavy. I totally agree
yeah,
with you. And I have to say, I mean, I'm huge on collaboration, right? So I love that you're going back and forth with this rehabber and they're going back and forth with you, because I do think, collaboratively going off of everybody's strengths, that's going to be the optimal outcome for the patient, right? I don't think anybody should be too proud, right? We really need to work together.
And I think that it's just, for me, it's so important to, especially teaching the CSCC program,
Mhm.
is knowing where that line is, right? Like I had a dog come in yesterday, for instance, and the dog trainer was concerned about the way the dog was moving its limbs. It's a German Shepherd, so they're kind of wonky. Anyway,
Yep.
not to pick on them, but
Absolutely. Predisposed. Yeah.
sometimes their hocks are like all wonky and
Yeah.
doing
Oh,
stuff.
yeah.
This dog is big for a German Shepherd. She's a black German Shepherd, and she brings her hock totally together like many of them do, because they have all their weight forward. Why? Because their rear is weaker, because they're
Yeah.
sloped and all that stuff. But she also does
The
this
way they're
weird,
made. Yeah.
yeah, she does this weird sort of flippy thing with her front feet. And
Okay.
she is, my question going back, because she was being seen by rehab, is, do you consider her joints hypermobile? Because she could touch and go beyond her forearm when flexing the wrist. And I strongly suspect that she is a little hypermobile in her front, but she's only 8 months old. So that's the other thing, is that,
Yeah.
yes, the trainer was right to be concerned, but I'm not going to do a lot of things at 8 months old because
Yeah.
everything hasn't worked out yet, unless the rehab person tells me that's okay. So I want to go back to them and say,
Yeah.
where do you consider this to be a problem? And what do we need to work on? Do we need to work on like supination and pronation? Do we need to work on strengths? Do we need to, like, stretching is definitely not something we needed to work on. It's just getting the rehabs or the veterinarians' thoughts
Yeah.
on where do we focus our attention. I'm going to still focus on alignment. So one of the things that I would do with that dog is probably cavalettis, but I would also bring the cones really close together. So
Oh,
this outward motion
yeah.
is not an option, right? So
Yeah.
the cones gives them feedback.
Of
But it's
course.
also going to tell me whether the dog can or can't do it. Is it a habit because they're on slippery floors? Is it because of their structure or where they're at in their growth?
Yeah.
That's the great thing about fitness, is that it's always a puzzle. It's like, how many questions can I ask the owner to get down to why this is happening?
Yeah, for sure. It's always going to be all those kind of factors, right? So it's not just physical. Could be behavior, right? Could be a mindset.
Literally habit. So many sloppy sits are from being asked to be on a slippery surface in a crate all the time, being on a slippery surface in the house all the time. And that creates a lot of problems. Like I can show you pictures where I can be like, that dog sits like that because it learned to sit leaning up against the side of its crate on a slippery surface. That dog sit is because it's been on slippery floors. Like I've seen enough dogs with these problems that now I can be like, I know exactly why that dog is doing that. But I think that's often the difference between me and other coaches, is just I am super observant and I'm always trying to connect the dots. Not to say that I'm better or anything like that. It's just that I'm always watching the dog. So and I'm trying to connect those dots always if I can. And sometimes you can't connect them, but it is really great to be able to know when you see a dog, okay, this dog is sitting like this. My first question is, what kind of floors do you have at home? Everybody wants to have slippery floors, not slippery floors, but they want to have floors that they can mop easily because they have dogs. Fits are not generally a great idea for most people because it's too hard to keep up. But it does take its toll on a dog. And if you have a dog that has to sit right for obedience or for anything like that, then you're going to work against it a lot. Yeah. And having that dog sit on a non-slippery surface and then maybe down instead of sit on the slippery surface, is a better option. So that I'm going to segue into your original question, which was case studies or dogs that I've worked with. Get back to that. I had a Malinois that had a knee surgery. I don't want to go into it too much. It wasn't a surgery that I really knew about. It wasn't a TTA and it wasn't a TPLO. The surgeon actually called it a reverse TTA. And I have asked many people about that. And they're like, reverse TTA. It's a little weird.
Not a common
thing.
Technique. Nope.
And it's a Malinois, right? And the client kept saying, is she going to be able to go back to sport? And I'm like, I don't have an answer to that. I don't know because I don't know anything about this surgery and I haven't seen it. So I personally have not seen a dog recover and go back to sport like I have with TPLO and TTA. She was told to walk her dog. She's a person who likes to compete at a high level in protection. She was told to walk her dog. She was not referred to rehab. She was eventually referred to me. And so we set out on this path to return to sport. And that is one of the things that I specialize in is get a lot of referrals from rehab because they don't know anything about the sports. And I have a lot of research. My big thing is I start everybody out like a baby. A baby dog.
Of course.
And I build them up from there. And sometimes that goes fast and sometimes it goes slow, if that makes sense. So it just depends on what their experience was before that. And then if you can do X and not have any symptoms, then we keep going. If you do X and we get something, then that tells us there's a weakness that we need to address. This particular dog, we did a lot of different strength exercises, looking at alignment. She, interestingly enough, was not like the typical TPLO that was super out to the side with the knee at the beginning. The other thing that we did with this dog was we walked hills every week.
Interesting.
Like we started walking a few 2 miles, and then we were actually up to 5 miles for a while. There's a really good trail that we used to meet on and walk our dogs.
Yeah.
And then that turned into recalls uphill as well. So we would put her in a stay at the end, at the bottom of the hill, handler would walk up. And then we paired that obviously with exercises in all planes of motion. So we're moving her forward, back, and side to side and making sure that everything is strong. And she went back to sport and earned her title, and the handler.
Oh, that's awesome. Yeah.
Well, and Malinois are not the easiest dog. She was fortunately a social, easy Malinois. She wasn't, the high strung, always anticipating what's next kind of Malinois, if that makes sense.
Yeah. Yes, it does.
So she was level headed, we'll say.
Okay.
And so she was one of those dogs where, and I still have not, that was years ago, and I still have not ever heard of that surgery ever again.
It's not common. I could tell you it's not, at least in my region, it's not common. So I don't know where it is, but in my region, it's not. That's for sure.
I do find with surgeons, and this is what you want. And I always tell owners this, they're like, what do you think between the vet said I can do a TTA or I can do a TPLO? And I was just like, the first question I want to know is which one does the vet do more often?
Yes. That is a great
That's the very number one question. And then my number two question is how unstable is the knee? Like how broken is it? Because what I do a lot is I have a lot of clients that they consult with me, they pay me for time to put into layman's terms what the vet is saying to them.
Yeah.
so that they can make a decision. And I'm not there to lead them in any direction. And I generally won't say things like, if it was my dog, I would do this. I try to give them the facts. And if I don't know the answer, I think that's one of the things that happens in the professional world is oftentimes people are afraid to say they don't know the answer. I am right there to be like, I don't know the answer. And if I need to go do research, I'm happy to do that. But don't be afraid to not have the answer. Like, I've been living in that world with fitness forever. Like, for so many years, people are like, what's the protocol? And then the word protocol makes me itch because because it's different for every dog. I could have 5 dogs that had a knee surgery, say, no matter what the surgery was. And all the exercises are going to be different because the dog does things different, because the handler does things different. Like, so many exercises get chosen because there's sometimes where I choose an exercise that's not exactly what I want, but the handler is incapable of getting the dog to do exactly what I want. So I'm trying to marry those two things together all the time. And that's why
only training the dog, but training the handler.
Because if the handler can't get the dog to do it, why send them home with the exercise? Send them home with something that's close, but and you might get to that one once they have experience doing this other one. But I think it's really important to consider who's doing the exercises with the dog. And I think a lot of people are scared to death that they're going to injure their dog again. And they don't want to do the exercises. They want to, but they don't want to because they don't want to break their dog. And I always tell them, when we get that the bone's growing, everything's good, that statement from the dog from the veterinarian, I'm like, you don't have to worry about that leg anymore. It's stable. Like, we're headed in the right direction. You have to worry about not doing things because you don't want to injure the other one.
Yeah.
So,
no, those were all good points. And I, especially going back to whether you're the fitness trainer or the practitioner, things like that, don't feel that imposter syndrome and don't be too proud. Like, definitely say, listen, I haven't dealt with this before, but what I'm going to do is I'm going to look into it and I'm going to ask some questions. There's a community that I know I can reach out to, because there's definitely a community out there, and I'm going to see what I can do. I'm going to see what's been done before, and we're going to play around with it. And I also think it's super important, like you said, to make sure that the owner, the handler, the pet parent is capable of doing the home exercise program, right? Because I totally get that nervousness and that anxiety on the client side, right? Even if they do make the dog do it or the animal do it, and they're still not even feeling confident, you might not want to send them home with that if they're not feeling confident about it yet. And again, we're training both. We're training both the animal and the client to make sure the optimal outcome comes out of it, for sure.
Absolutely. And so many owners are afraid because for lots of reasons, surgery is expensive. Their dog is out, not able to do the things that they want to do. I get that question all the time. How do you keep, we'll say, a border collie quiet during recovery? And I'm like, it comes down to heavily managed. They have to be on leash, maybe even in the house, they have to be on leash, but it just depends on the dog. But talking the owner through and not overwhelming the owner. That's the other thing. When I first started doing fitness, I wanted to impart all the knowledge. And
here's the book. Take it home. Read it.
Plan, when we came back a couple of weeks later, and I'd be like, crap, I gave you a lot of stuff. But so it's also paring things down to where the owner feels like it's doable. And so oftentimes I generally give 3 to 5 exercises. It depends on the owner and it depends on where the dog is. And so if I want to say I'm at 3 and I want to give a 4th exercise, I will say to the owner, I would like to give you 1 more exercise, but if this is enough for you, just tell me it's totally okay. And I've absolutely had people say, no, let's stop at 3. This is a lot, because I get people telling me, that's a lot of details, Bobbie. And I'm like, it is. And my goal is not for you to get it all right, is just to remember some of these details because everything is progressive. So even if you just remember, like when your dog is sitting on a bench and their knees are pointed forward, their feet are pointed forward, everything is fine. And you recognize that, and you can recognize when they are sitting, when they're on the flat, when they're doing whatever they're doing, and that the goal is to not deviate from that position as you move forward on equipment. I'm happy. If you can recognize that, and then you have to realize that's a sign of fatigue. It's a sign if they deviate from it. So if their knees start falling out, whether they're on a bench or not, or an aerobic bench, they're not using the right muscles anymore. Now they're pulling with their front because they're not actively engaging their rear. So
classic weight shift. Yeah.
And some of that is just, it is a lot of information, and I don't expect them to remember everything. And I do write down things. I do have them videotape either myself or them doing the exercise with the dog so that they have them. I do find that if they videotape it on their phone, or if I do and text it to them, then they're much, much more successful. And I get email questions in between.
Very cool. That's good insight. Good insight for sure. What I want to get into next is the course, right? Okay. What does the course consist of? How many days? Obviously, you're the lead instructor there. Do you have anybody else that helps you out? Yeah, let's get into the CSCC course.
All right. My favorite subject.
Right.
I put the course together a couple of years ago. So let's see. I think it's 2 years old now, almost. Is it 2 years old? Something like that.
I think just about, yeah.
Yeah. And I work a lot with Kirsten Holt, who is she's a dog trainer. She assists the program when we're teaching the lab. She's located in Florida currently. I have Jamie Sheehan in North Carolina. She teaches out of Quicksilver Canine. She comes and assists the labs as well. And Meredith Willie is a rehab professional. She owns a rehab practice called Steel City Rehab. She assists the program as well. And we all grade case studies amongst all of us.
Correct.
And then I also have Beth Bauer, who is a veterinarian her business is, what is it? It's escaping me right now. I don't know why.
We can find it and in the show notes.
Veterinarian in Raleigh. It's North Carolina Ranch. I think it's like veterinary resort, something like that. Then Sherman Knapp with VOSM is our advisor. So if I have questions about anything, muscle mechanics, I'm like, hey, I have this movement is happening. What's happening with this dog? Or is this an exercise that I want to put out to the masses? Or is it something that's more of one-on-one? Or maybe I want to find out information about studies he's done or food analysis or any of those things. He's there to help in any capacity that we need. And then just having a wide variety of people to collaborate together and make the program.
I love it. I love it. I think that's the best approach. And I couldn't applaud you more to have that kind of course like that for sure. So give it a breakdown too, the day-to-day breakdown of the hands-on labs.
First, I'll just mention the online portion is about 13 and a half hours currently.
Okay.
You do, once they're signed up, they do have access to it we say forever. Forever is a hard word for me. I always say in my online class that they get access for at least a year, but if I get run over by a truck, it'll be shut down.
Let's hope that doesn't happen, but yes.
Right. The CSCC program is located on the server for the NC state programs. So you do have access. That was one of my big things, is that if I change something about the program or change how we're doing it, which we did a lot with the CCFT program because it was new and trying to figure out how to do everything. I want people to have access to it if I change it and not have to necessarily pay to get those changes. So this is a evolving field. Obviously, rehab is still not a household name, we'll say, in a lot of places. And if that's the case, then fitness hasn't even been mentioned yet. So we still want, but I do want to say it's come so far. Like I said, I collaborate with so many other veterinarians now that I'm amazed at how open-minded they have become.
Thankfully, yes.
Yes. And how they have seen the benefits of having somebody who knows how to work with the dog.
Mm.
And I think that is just a huge thing. The training part of it is just huge. But
Yeah.
anyway, you can generally go through the online portion fairly quickly. The big piece that we're struggling with right now is Unit 4 is all of the training of the foundation behaviors. So all of the targeting behaviors like front foot targeting, rear foot targeting, side feet targeting, all that stuff, chin, nose, all the things that we use for fitness. So like a chin rest can really easily be used to get stillness. There's also information about it's your choice, which is it's a common thing in the performance world where we use, where it's basically, it's a believe it concept, but basically you hold food in your hand. Dog is not supposed to come forward to your hand. So that's how we get the stillness. And you just train it by dog comes forward, hand closes. Dog back away, hand opens. As long as they stay backed away, they get the cookie. So there's a lot of information on how to get the behaviors that we want. When I first started teaching fitness and for many years after, the biggest complaint that I got from people was that fitness took too long. And part of the reason that it took too long is because they were struggling to get the dog on equipment with front feet and rear feet, for instance.
Yeah.
And by the time they got them on the equipment, they're like, phew, done. And then the actual exercise they were supposed to do got forgotten because they spent 5 minutes trying to get their dog on equipment. So that kind of led me to the targeting and putting it on cue. Bam, put your front feet here, put your rear feet there. Now let's do the exercise. So that's unstable surface or stable surface. The idea is that when you're going through the online portion, you also spend time with your dog going through at least some of those behaviors and learning about them before you come to the lab, because it makes it easier for you at the lab. But I'm working towards a situation where you can get feedback on some of those exercises. And maybe in the future, we will actually require a certain number of those exercises to be videotaped and turned in, just because I think it's a piece that is not being done as often as I want it to be. And that's just because we're human.
Of course.
We're busy trying to get stuff done. It's a lot more beneficial if they actually practice. And it's actually one of the questions I ask at the lab. I'm like, so how many of you guys practice module 4? And they're like,
one.
I feel like I'm seeing more. I've also put a lot more kind of reminders in the program about it, but I'm seeing more and more people that are spending that time. And also, I have a lot of people who take my regular classes that have gone through the program. They don't have to practice because they've already done it. But the lab is generally 3 days. It can be virtual or in person. Right now, we do an in-person lab at my studio with a small group, and then we do a bigger group at NC State.
Okay.
And so the NC State program usually has 25 to 30 people in it.
Yeah.
My program at my studio is usually 12 because I just don't have that much room. And then I have run a hybrid as well, where there is 10 to 12 people in person. And then I also have 10 to 12 people online at the same time.
Very interesting.
So from the dog trainer standpoint, I love the hybrid because I can get my students to use their words rather than shove the client out of the way and be like, this is how you do it.
Right.
I used to have clients all the time come in and say, I'm having trouble with rock back sit. I can't get my dog to rock back sit. Of course, I can get their dog to rock back sit in a second or two because I've done it with 1,000 dogs. And then I'll get from them, I hate you. I don't really hate you. They're just like,
I know. Yeah. The reaction.
I feel pretty good with my clients, so we can pretty much say anything.
Yeah.
But now I don't do that anymore. I just sit in a chair and I say, show me what you got. Let's see where you're at. And how do we adjust that so that you can be successful? And it doesn't mean that I don't work with the dog. Sometimes I do, because sometimes I really don't know what's going to work for this dog unless I do it myself first. Just because the dog is I'm not going to say the dog is being difficult. The dog is not understanding what we're trying to lay out for them, right? So either we have not found the right combination of things to tell the dog what to do. Going back to the lab, It is hands-on. So if you're online, you work with your own dog. And I cannot stress enough that if you are online, you are actively working. It is not just a sit back with a cup of coffee and listen to the background kind of lab. It is, you are actively involved. You are put, if it's an all virtual program, you go into breakout rooms, and Kirsten and I pop in and out of there. And then you come back into the main room to demonstrate whatever we're doing. And we go through all of the things. We go through posture assessment. We go through what kind of exercises do you start with based on that posture assessment? What kind of exercises do you do in certain situations? Because it's a foundational program, we do a lot of things like what is the muscle action, say, for like the supraspinatus, that muscle in charge of, and then what exercise does that action. And so that's just a great starting point for people to understand how all the things fit together.
Yeah, I think that's good to have that kind of background to it, the knowledge, the purpose, right? The why, right? Like, why are you doing this? Yeah. It's super huge. It reinforces you on even the client on what they're doing, what their goals are. And here's the why, right? This is why we're doing this, because you want that, right? So yeah, no, that's super huge. And that's awesome. It sounds pretty exciting. And I applaud you for being able to do like the live and hybrid kind of deal. I'd probably go crazy trying to bounce back and forth. It sounds like you're definitely trying to help as many people too, which is really awesome.
And really trying to make that experience as good as being in person as I can, if that makes sense. So we do try to, like, one of the first things that they do is there's a homework assignment that gives you a muscle action or something. And it generally will say, create 2 exercises or come up with 2 exercises that are going to work this muscle action. And then what plane of motion is the exercise in? And can you teach someone else how to do it? Generally, like I said, I like the hybrid because I can pair my in-person people to coach my online people and the online people to coach the in-person people.
That's cool. I like the interaction.
Cannot shove the handler out of the way.
Yeah.
And in person, we have the coach sit in a chair or stand on a dot. And it's really interesting to see how hard it is for them not to take over.
Yeah.
And I'm like, if you take over, the owner is going to go, and they're going to get home. They're going to be like, I have no idea.
Oh, yeah. I've seen it myself where they're just nodding and they're looking through you, not at you.
Yeah. But it's like, yeah, that's a lot.
Exactly. Yeah, sure. Yep. Totally. Gonna do this. Yeah. Nope. Everything's washing away.
So it is, like I said, it's 3 days. It's mixed in with lecture. I don't recreate the wheel during the lab. The lab should be applying the information that you learn online. And it very much is that. So
very cool.
The PowerPoint presentation, for instance, has slides on the posture assessment, but it's literally grab those slides. Here's your dog, assess the posture, come back, tell us what you did. I don't want to create the wheel. I feel like that a lab really should be an extension of learning, and it shouldn't be the same thing again.
Okay. Yeah, no, I think that's pretty awesome. And I think that's huge, right? The modules are there for your theory, your study. And then, lab is practical. Now put it into application. Let's see it. No, that's huge. And I think it's really cool what you do. And for the listeners out there, I implore you, whether you're a rehabber or not, or just looking to get into fitness, I think this is a really cool program for all aspects and all professions to really revamp, re-educate, or just learn something new, honestly. And speaking of learning something new, for yourself, have you seen any kind of emerging trends or advancement in fitness training at all?
I think the advancements happen based on the knowledge of the people who are doing it, if that makes sense. It's not as great as veterinary medicine, where somebody comes up with some new reverse TTA, for instance.
Yeah. A miracle injection.
Right, or whatever. I think that with fitness, it's just more knowledge as we observe more and as we do more to be able to help the dogs better, and being able to draw those parallel lines. Sometimes, like I said, like I've been doing these exercises a long time, and knowing how the dogs are going to respond to equipment and how they're going to respond to certain exercises, and knowing when to change the exercises because they're not working. I can't tell you how many times I have given an exercise to a client, and when they come back, I'm like, it's not really doing what I want, or they weren't able to achieve it. And that's okay. And I think that's one of the things that gets people with fitness is that it doesn't fit in a nice, neat box. It's not step 1, step 2, step 3. Yes, there are steps, but the exercises that you choose for one dog are going to be different than the exercises you choose for another. And having the open mind to work through that is really important in fitness. Because like I said, if you go to a rehab course, which you did go to a rehab course, they give you this, we'll say, small amount of exercises that have been involved in studies or whatever. And that's the piece that's missing in fitness, is there's not a lot of studies. There is anecdotal observation and result that have come from those that tells us that therapeutic exercise is good for the dogs. And it helps them go back to their normal activity. It helps keep them injury free. It helps make them strong enough for the job that they're being asked to do. I can't tell you how many of my performance people have high expectations for their dog, and they do not consider what they're asking of the dog or how many repetitions they're asking or any of those things. And so that education piece is really important. What I have seen over the 18 years I've been doing this is I've seen a lot more dogs go back to sport after injury. I have seen a lot more open-minded veterinarians and rehab staffs that are willing to work with and collaborate with somebody who does fitness. I have, again, in the very beginning, I just wasn't a thing.
Yeah. No, you're right.
I have seen a lot of, again, I'll go back to something that Hannah Brannigan used to say to me is when I would say, okay, Hannah, we really need to train rear foot targeting. And she would say to me, I have 15 minutes per day to spend training my dog for obedience. And why should I spend part of my 15 minutes to train rear foot targeting for you? And so I have to come up with the right answer, right?
Yeah, absolutely.
I have to tell her that if she trains rear foot targeting, then her fitness will take less time and she can spend more time training obedience. And that's the answer. And so I think also communication has gotten better, but I know that none of what I have said is like that silver bullet of magic, if that makes sense.
Yeah, no, it does.
Innovative or anything like that. I could say that I come up with exercises sometimes and I would call them innovative because I'm like, wow, that really works. And sometimes I come up with exercises and then 6 months down the road, I throw them out. I'm like, man, it's not really working. But I'm willing to, because that posture piece is so important, you have to be willing to try things and see if it works for the dog. So like a fitness plan that you design and a fitness plan that I design might be different, but they might meet. They might totally go to the same goal. And that's okay.
Absolutely.
Because there's not a if this, then this 100% every time. That's why the word protocol makes me crazy. Just because I feel like dogs are individuals just like we are, right? And they do things differently. And so much of what the dog is doing is about what the handler is doing as well. So I have dogs that are muscle imbalanced because of where the owner holds their treats. The owner is always treating the right hand. So I have a muscle imbalance because they're offloading to their right side. So they're angling. Yeah. And these are things that people don't pay attention to. Can I say that it's innovative that I pay a lot more attention to tail set than I used to, because a lot of dogs have too low of a set tail. to sit appropriately. And if they try, they end up putting a lot of pressure on their lower back. Does that mean they should never sit? No, but if they're an obedience dog, I'm going to ask that owner to down them and only sit when they need it for performance. So I would say that there's a lot of innovative things that happen during training, but is it as widespread? I think that's where the continuing education piece comes in. And that's what we're working on next. How do you, if you have a dog like this, what are the exercises you might choose? And what do you try? What do you try first?
Yeah. I think that should always be the emerging trend, right? Continuing education, getting better, knowing that it shouldn't be an exact protocol. It should be what your patient is presenting, what your patient does, whether it's a working dog or just a dog that likes to go for a walk or likes to go for a hike. There's so many different variables in especially the rehab world, what a protocol should be, right? It should just be more of a plan, not a protocol. So I absolutely agree on the whole protocol word for sure. It's more of patient's plan, it shouldn't be the patient protocol.
It all has to do with how you have things set up. And sometimes it's just semantics. But people will ask me, what's the protocol for that? And I'm like, okay, first I have to see the dog. Like I had somebody ask me the other day, they sent me pictures on Facebook. And they're like, my dog had a shoulder surgery and is weak in the rear. What should I do? And I'm looking at the picture and the shoulder that was injured, the dog is totally has the whole limb actually rotated out laterally. And I'm like, I just made a comment about that. She sent me a couple more pictures that said, oh, here's a couple more pictures. And I'm like, yeah, okay, so your dog's not rotated laterally, but doesn't have any weight in that foot. And I just said, this is more of a private lesson kind of thing via Zoom because she was far away, but not something I can answer on Facebook.
Yeah.
Because is that just a snapshot of the dog in that moment, or is the dog really not using that?
Yeah, no, it's true. A lot of media can only be telling for that one exact moment, not the overall what's happening. Right? So, I agree. Yeah, for sure. I have to say, this was truly insightful. I myself am inspired to join your course and just refresh and reset my brain too. So I hope the listeners will join me in that aspect. And we're definitely going to have you on again. There's the ever-going topic of working dog rehab too, which I think is really important. And it's still an underutilized profession, whether you're a fitness trainer or certified strength and conditioning or a rehabber. So we would definitely love you on again, Bobbie. Thank you so much for this. And we'll see you soon.
Great.
And for the folks that are listening, we're going to have a lot of information on how to reach Bobbie, what the course is, all that fun stuff. All right. All right, Bobbie, thank you so much.
Thank you.
You've been listening to the Canine Rehab Movement Podcast. Thank you for tuning in. And for more information about our programs, please visit ncsuvetce.com. That's ncsuvetce.com. And for those of you who've made it to the end of the podcast, use the discount code NCSU100 and save $100 off of any course, $4.99 or more. Until next time, guys, this is the Canine Rehab Movement Podcast.